Every day, caregivers are faced with the challenge of repositioning patients up in bed multiple times throughout their shift, putting themselves, as well as their patients, at risk for injury. The Hercules Patient Repositioner from the Morel Company is the ideal, practical, and easy answer for safer and more efficient patient positioning. The Hercules system features an innovative drive unit, a pressure-reducing mattress, and a specialized reusable sheet that all work together to reposition a patient up in bed within a matter of seconds. The soft, synthetic sheet is twice as long as a traditional sheet, allowing for up to 10 repositionings. The sheets can be laundered using standard laundry processes and are easily identified by their unique blue hem. The Hercules system allows a single caregiver to effortlessly reposition patients weighing up to 500 pounds by simply pressing 2 buttons while protecting the patient's dignity, comfort, and risk of injury. Making the bed with Hercules is easy. To make the bed, ensure the sheet attachment strap is through the slot on the drive unit and not through the drive door. Place the Hercules sheet onto the mattress. Unfold the sheet at the foot end of the bed and locate the large red arrows printed at one end of the sheet. This is the end that will be inserted into the drive unit at the head of the bed. Pull the section of the sheet with the red arrows up to the head end of the bed. Connect the sheet to the sheet attachment strap of the drive unit by inserting the ends of the attachment strap into the buttonholes located at the end of the sheet. Please note, the attachment strap is used to load the sheet into the drive and is not intended to pull patient weight. Place the excess sheet between the mattress and the footboard, starting with the end of the sheet. Press the unlock and arrow buttons at the same time to advance the sheet into the drive unit until the red arrows have disappeared beyond the head end of the mattress. Secure the sides of the sheet by pulling the hem's edge into the sheet clips along both sides of the mattress. Simply grasp the hem of the sheet with both hands, leaving 2 to 3 inches of sheet between each hand and pushing it down on the clip. The sheet will simply insert itself. The Hercules system is now ready to reposition patients. Repositioning a patient is simple and only takes a few seconds. Before repositioning a patient up in bed, the head of the bed should be lowered to 30 degrees or less, ensuring the head-up LED is not illuminated. Also verify that the door-open LED is not illuminated. If either of these LEDs are on, the system will not operate. To pull the patient up in bed, use 2 fingers to press the unlock and arrow buttons at the same time. Release the buttons when the patient has reached the desired position. You will notice the drive unit will temporarily reverse to relieve the tension in the sheet, allowing the patient to re-immerse into the mattress for effective pressure relief. The Hercules sheet allows for a patient to be repositioned up in bed approximately 10 times before a sheet change would be needed. The last advancement of the sheet occurs when the red triangles on either side of the sheet reach the head end of the bed. When this occurs, the sheet can either be changed or it can be reset if it is not soiled. Resetting the sheet allows the caregiver to continue using a sheet that does not need to be changed when the patient is not in their bed. To reset the sheet, press the sheet release button located on the side of the drive unit. The sheet release button LED will now be illuminated. Pull the sheet from the foot end of the bed and tuck back between the mattress and the footboard until the red triangles on the side of the sheet reach the end of the mattress. If it is pulled out too far and the red arrows on the sheet become visible, advance the sheet into the drive unit until they have disappeared beyond the head end of the mattress. The Hercules is now ready to reposition the patient up in bed another 10 times. Anytime your patient is out of bed, take advantage of the opportunity to easily reset the sheet. To remove the sheet without a patient in the bed, first detach the sheet from the clips along both sides of the bed. Press the sheet release button located on the side of the drive unit. The sheet release button LED will now be illuminated. Pull the sheet from the drive unit. Disconnect it from the attachment strap and place the sheet into the appropriate soiled linen area. When removing the sheet with a patient that is unable to get out of the bed, please follow your facility's protocol for changing sheets with a patient in the bed, along with these simple additional steps. Ensure the side rail is up on the opposite side from where the caregiver is working. Press the sheet release button located on the side of the drive unit. Pull the used sheet out of the drive unit and disconnect it from the sheet attachment strap. Release the used sheet from each of the sheet clips along the side of the mattress by simply pulling down on the sheet clips and pulling up on the sheet. Lug roll the patient to the other side and tuck the used sheet under the patient. Unfold the new sheet with the large red arrows face up. Connect the new sheet to the sheet attachment strap of the drive unit by inserting the ends of the attachment strap into the buttonholes on each side of the sheet. It is important to remember to leave enough slack in the new sheet so that the red arrows are completely past the head end edge of the mattress. Secure the sides of the new sheet into the sheet clips along the side of the bed. Place the remaining part of the new sheet between the footboard and the end of the mattress. Tuck the new sheet under the patient. Ensure the side rails are up, then walk to the other side of the bed and follow facility protocol for log rolling the patient. Unclip the used sheet from the mattress. Remove and place in the appropriate soiled linen area. Insert the hem of the new sheet into the clips on the side of the mattress. Press the unlock and arrow buttons at the same time to load the sheet into the drive unit. Release the buttons when the sheet is loaded and the patient has reached the desired position. Hercules is now ready to reposition the patient up in bed another 10 times. It is important to remember that Hercules should be a part of your pressure ulcer management program. The position of the patient in bed strongly correlates to pressure distribution. When the head of the bed is elevated, gravity causes the patient to slide down in bed, increasing interface pressures in at-risk areas such as the sacrum and heels. Now, using Hercules, the patient's interface pressures can be managed more effectively because the caregiver can reposition the patient up in bed every time they enter the room, thus maintaining the patient in a lower pressure position more often. This addresses one of the leading contributors to pressure ulcer development and can ultimately help improve clinical outcomes and patient care. The Hercules Patient Repositioner, the new standard of care. For any additional questions regarding the operation of the Hercules Patient Repositioner, please contact your Morel representative or call the Morel Company at 855-932-6100.